Hi guys, welcome. My name's Kieran at the One Zen Academy and One Zen Wellness. Hope this finds you well. So I've got with me, I thought of many names for my skeleton. I'm going to call him Daniel. Purely because it's the most random name for a skeleton I could come up with. Daniel. So, Dan for sure, obviously. So Dan is going to help me demonstrate certain anatomy points, and that's what these next videos are going to be about. And you may be thinking to yourself, why is this relevant? I just want to train, or I just want to do X, Y, Z. It's really important to kind of check our understanding of why we're doing certain things. So you'll often hear, so I've been to many yoga classes, for instance, and they'll always say, you need to stretch your hip flexors out. And I'm like, well, why? Why do I personally need to stretch my hip flexors out? And there could be really valid reasons, but there might not be as well. So what do my hip flexors do? Why is it relevant? How are they going to help and support me through either everyday life, running, weightlifting? Maybe you're a personal trainer or sports therapist, training up, and you need to know a bit of anatomy. So this is all relevant to most people. So I've got this band here which represents our muscle. And we know that with our hip flexors, there's a few of them. So we've got psoas major, and if we've got a major of something, it means we'll have a minor. So we've got psoas major, psoas minor, and we have iliacus. Okay, and we call them iliacus psoas muscle group. We also have one of our quadriceps, so these muscles at the front of your thighs, called rectus femoris, which actually helps assist with hip flexion as well. So what is hip flexion? So hip flexion is basically that movement with your hip. And you can see that whatever I do with my hip happens at my knee. So if I go through hip flexion at my hip, I'm going to go through knee flexion. If I go through extension, which is coming back, then I'm going to go through knee extension as well. So the knee basically does whatever it's told by either the hip or the foot and ground reaction force and so on. That's for a different time. So the psoas major and minor, okay, tend to start from T12. So our last thoracic vertebrae is easy to kind of visualize because it's the last vertebrae with a rib on it. So we have 12 ribs. And it goes from L1, 2, 3, and 4. So they're the more superficial layers. And we have some real deep fibers that also attach themselves into L5 as well. And so to give you a visual demonstration, that's where it starts from. And it comes all the way through the hip. So it's very three-dimensional, through the hip. And it attaches itself into what we call the lesser trochanter. So the greater trochanter is that bit on your hip that you could probably feel if you wiggled your finger deep in your hip and you moved your leg around. You'll feel the top of the trochanter, the femur, which then becomes the neck, and the ball and socket joint, the acetabulum, that sits in the fossa. So the lesser trochanter is just round the corner here. So it's a little knobbly bit. You'd be really hard pressed to try and get in there and have a rummage. I probably don't recommend it because just don't. So it attaches into there. So I'll try and put some tension on this. Okay, and when it contracts, it basically shortens and lifts up like that. And it shortens because it's a fusiform muscle, which means the fibers run parallel to each other and they're kind of staggered like that. So psoas major and minor does that. Iliacus, okay, is within the iliac crest, which is that crest-shaped part of your hip. And we have a fossa, which is that indentation. And it kind of sits in that bowl there. And again, it attaches into the same place, attaches into the lesser trochanter. So we have this real broad area for hip flexors. And our rectus femoris, we have this little knobbly bit here. So these parts of your hips, you could feel, they're the ridges that stick out. They're called your anterior superior iliac spine, ASIS. If we have a superior, it means we have an inferior. So we have this inferior part of your spine. So it attaches to there and blends into the rest of the quadriceps to become the patellar tendon all the way down here. So we have this really broad area for our hip flexors. Now, here's the tricky part, is that our hip flexors have a mixture of slow twitch and fast twitch. So they both can be endurance. So they can be endurance, which can help with, you may be thinking, well, long distance running, but they're postural as well. So we obviously need to have a lot of endurance, slow twitch fibers for postural related muscles to help us stand up, and they're very oxygen dependent. But then we also have a lot of fast twitch fibers within this as well. So explosive, short, so white blood vessels, you'd be dead. We have white fibers, so they lack proper blood supply, so they're dependent on the creatine phosphate system, so the explosive energy. We have a mixture of these fibers within that because they have to be able to do both. Now, here's the kicker. If one of my hip flexors is shorter than the other, so for instance, this hip flexor is shorter, what it will do, it will rotate like that. So if this one's short and this one's longer, it will create a rotational force at my vertebrae, okay? Definite back pain. If they're both short, for instance, okay, it's gonna pull these vertebrae forward like that, and it will look like this. So you'll have this massive lordosis, this kind of duck's bum here, and you'll walk around like this, like you've got carpets under your arms, so to speak. So, and that's what it will do. If they're too long, for instance, if they're quite weak, not too long, if they're quite weak in relation to the other muscles round here, it may mean that you do the opposite and you have what we call a posterior tilt. So that's when your pelvis rolls that way. So your ASIS starts going backwards and you start getting this real flat back here. So we need appropriate tension through our hip flexors and rectus femoris, but we also need appropriate tension through the other muscles in that area. So just to mindlessly keep stretching and stretching and stretching your hip flexors probably isn't the best thing. So the questions you should ask yourself, are my hip flexors tight? Do they feel tight? Does one feel tighter than the other? Okay. Do I have low back pain? Because tight hip flexors, or dysfunctional hip flexors I should say, are often implicated within that system, as well as quadratus lumborum, which kind of sits, I guess, like that. So it kind of is involved in lateral flexion, but it can also refer pain if it's dysfunctional. So it sits at a very slight angle, okay? So it sits at a very slight angle. So if you're ever doing, you go to the gym and you get on one of those ab crunch machines that pulls away from back here and you do that, it doesn't really work your abs, by the way. You're actually initiating that movement through your QL because of the line of pull, and it creates this little flicker and creates tension that refers pain, normally around T12, L1, and you get this kind of mid-low back pain. If you're, for instance, doing a lot of stiff leg type deadlifts, you'll normally feel pain around L4, L5, L5, S1. So all the way down here, you'll start getting that back pain as the tension through whatever weight you're lifting has to go through there, which is why I opt for more of a sumo stance, wide stance deadlift. But that, again, for a different time. Your hip flexors, however, if you're running, okay, will create stability. Okay, so remember they're going from here. They'll create stability in one part along with multifidus. So multifidus is a deep back muscle which basically minimizes rotation at the vertebrae. So it'll minimize that. So if I've got optimal range of motion through my hip flexors, then chances are they're not really the issue. And I would look at other muscles, which we will look at in other videos. But just to finish off with regards to the hip flexors, and one of the reasons why they might come dysfunctional is because they tend to blend, not necessarily tendons, but aponeurosis, which basically is like a tendon type junction. So it's when a tendon inserts into another tendon. We have our diaphragm, which is very broad and kind of sits like this underneath. There we go, like that. So when you breathe in, it kind of drops down, and when you exhale, it goes back up again. So it does that. And imagine your heart's pumping away here through your diaphragm. Oh, is he going to fall over? Nope. He just wants to turn away. I'm so sorry. I'm talking to my skeleton. So your aorta, the main blood vessels of the heart go through there, as long as with certain nerves. So in times of stress, for instance, the diaphragm won't contract anymore, and it won't contract because you're not belly breathing anymore. So you're breathing through your intercostal muscles, which kind of sit in between the ribs, and they will open your ribs and expand them like an accordion. And because these don't serve the purpose anymore, they don't nourish everything that's around them, so your digestive system will basically not do as well because it's not getting that constant massage from the diaphragm. But also the top of your hip flexors, so you may find T12, L5, L1, L2, for instance, they don't get nourished with that massage, that blood supply. So sometimes people who are highly stressed often get dysfunctional hip flexors purely by way of the sympathetic nervous system kind of turning the screw and starting to tighten everything up. So a nice way, if you are feeling really stressed, is to try and release your diaphragm, and you can do this by basically tickling the front of your sternum, and if you follow your rib cage and tickle that, like that, like that, and you just basically create a nice feedback, because tickling's nice, a nice feedback that tries to relax your diaphragm. Try and get some nice big belly breaths, so really expand that out, and then try and stretch your hip flexors. So we're kind of making sure that making sure that this leg is back and you're opening up. I know that's hard to see from that angle, but we're trying to open up. So to stretch hip flexion, we need to go into hip extension. And you're really trying to open up by basically putting a stretch on that muscle, stimulating the Golgi tendon organs, which will create a relaxation effect, and you'll get this, and you'll feel that. And that's why sometimes in the long holds in yoga, for instance, you come out of it and you think, wow, I feel awesome. It's probably because you were highly strung and highly stressed before, and what that yoga session has done is stimulated the parasympathetic response, the relax and digest response, and everything's gone, yeah, and you just let go. So why is it important to look after your hip flexors? One, to decrease any lower back pain type issues. That could be from a single hip flexor or both together. Remember, if they're both kind of dysfunctional and tight, causing lordosis. If one is, then it causes a rotation. So making sure that they're both fairly equal and they both have a decent length throughout. But also stretching down into your quadricep, because we know one of our quadriceps, the rectus femoris, remember, comes from the inferior superior iliac spine. Remember, superior, inferior, and blends down. We know that that's also involved in hip flexion, so it's really important to stretch out your quadriceps as well. I would say look up things like the Thomas test. If you type in Thomas test, something like YouTube, you'll see how that can be changed, not just stretch your hip flexors, but also your quadricep. It's quite easy then to replicate that yourself on a mat, whether at home or in a gym. So that's all I've got to say on hip flexors for now. I may come back to it at a later date. Thank you so much for watching. If you find this interesting and how you want to apply it to maybe fitness, so remember the academy, we've always got the diploma in personal training going on. A lot of it is on Zoom, so Zoom live lectures and in-person practicals. So it takes place over 7 months. It's a fully internationally recognised qualification. So if you're interested in that, get on it. Why not? But failing that, make sure you subscribe to this channel. Make sure you share it with your friends. And yeah, thank you for watching. Thank you.